Welcome all to Raaonline. So by seeing this image, you will come to know what is today's topic. It is the tetanus. Okay. So why should we really read on tetanus? What is the global burden? It is almost more than 1 lakh cases per year are being reported with a mortality of around 40%. And moreover, tetanus is a reportable disease under the National Notifiable Disease Surveillance System. Okay. So, as per the CDC's definition, what is CDC? Center for Disease Control and Prevention. What is the definition of the tetanus? It is a syndrome of acute onset of hypertonia and or painful muscle contraction, usually of the muscles of the jaw and the neck, and generalized muscle spasm without other apparent medical cause. Okay, so it's basically a severe contraction issue, right? So what could be the other differential diagnosis? It could be strychnine poisoning. Yes, we already have a separate session on strychnine poisoning and how to differentiate it from tetanus, right? So in one way to tell, there won't be any wound related history in strychnine poisoning, but in tetanus we do have that, right? The other details we can see in strychnine poisoning later. So the other differential diagnosis are the dystonic reactions when patients are on metoclopramide or phenothiazines, hypocalcemic tetany, malignant neuroleptic syndrome, the serotonin syndrome, stiff person syndrome, peritonsillar abscess, peritonitis where there will be severe guarding and rigidity of the abdomen, meningeal irritation because of bacterial meningitis and SAH, rabies and temporomandibular joint diseases. Okay, all these are differential diagnosis of a tetanus. Though there were a lot of cases of tetanus previously, it has seen a significant fall because of improved childbirth practices, widespread immunization program for children, and decennial tetanus boosters for adults, and the mechanization of agriculture. More machines are involved in agriculture rather than human population, and use of chemical fertilizers rather than animal manures. All these things have resulted in more than 95% decline in annual incidence of tetanus in US since 1947. So now coming to the wound. The wound carries a special mention as far as tetanus is concerned, because as we already know, the standard teaching is if there is no wound, there is no tetanus, right? But let us take home this message today. No wound actually exists in up to 10% of patients with tetanus. Okay, in up to 90 to 95% you will be able to identify a wound, but somewhere around 5 to 10% you may not be able to identify the wound at all. Okay, so mostly 70% of the wound is going to be a puncture wound or devitalized wounds, and less common will be the chronic wounds and dental abscesses. Okay, when you hit over or get a wound because of this kind of rusted old nails or any organic matters, that has more tendency to develop tetanus. What are the other sources? It can be because of a contaminated surgical procedure, otitis media, most oftenly we miss it, or abortion which is not done in a very proper way, or injection drug uses from contaminated heroin, adulterated heroin, and in neonates through the infection of the umbilical stump. Okay, even now in certain villages, the cow dung is being used over the umbilical stump as a cultural practices. So all these things is more prone to develop tetanus. Now coming to the pathophysiology. Understand Clostridium tetani is a motile, non-encapsulated, anaerobic gram-positive rod. Anaerobic. Anaerobic means there is no oxygen. Okay, so how come bacteria which has anaerobic tendency live inside a human being who is almost dependent on oxygen? So this indirectly tells you that those tissues which are almost dead or dying, that is the hub of Clostridium tetani. Okay, so it's an anaerobic gram-positive rod. So this Clostridium tetani exists in either a vegetative or a spore forming state. Now the journey inside our body. The spores are ubiquitous in soil and animal feces, and it can survive on environmental surface for years together. Okay, so when this tetani is introduced in a wound, it usually is the spore forming non-invasive state, just a spore. Okay, when the resources are very minimal, when the nutrition is very minimal, when the environment is not favorable for growth, this favors the spore type of state of Clostridium tetani. But once the spore enters into the human body, when the environment is better, then the spore state goes into a vegetative state. Okay, so this germinates into a toxin producing vegetative state if the tissue oxygen tension is reduced.